The federal government is making it easier for doctors to prescribe methadone and pharmaceutical heroin. This is all part of efforts to help fight the growing opioid addiction crisis. The federal health minister made the announcement today at a homeless shelter in Ottawa, and the CBC's Susan Lunn was there.
It is the file that keeps me up at night because I think time and time again of the families that are devastated by this issue.
Federal Health Minister Jeanette Petitpas-Taylor introduced changes today to help stop the number of overdoses by making it easier for doctors to prescribe methadone and heroin to treat addiction. Welcome news for those on the front lines.
They get their clean supplies. We have needles, ties, cookers.
Daniel Davidson works in this supervised injection site. It opened last fall.
When they come in, they go to a booth.
Since then, Davidson says staff have overseen up to 250 injections a day.
I was surprised. I didn't realize that it was such a big problem, that there was such a large amount of people that were coming in and using. I didn't realize that people were using like up to 5 times a day, if not more.
People who come here also get help with their addiction, including for some, a spot in a program that supplies clean opioids. Right now, that drug is the easier to prescribe dilaudid. But under the federal changes, prescription heroin will be available for the first time outside of a hospital setting. Good news for Dr. Jeff Turnbull, who runs the Clean Opioid program.
We'll now have the opportunity of either choosing dilaudid, injectable dilaudid, or injectable heroin. Now, there are differences, and we'll be able to select, when appropriate, the right medication.
The new rules will kick in May 16th. Susan Lunn, CBC News, Ottawa.